So I'm going to start by saying thank you very much, everybody who's come along for today's session. For those of you that don't already know me, my name's Ifeoma. I am the Director of Public Health at Halton Borough Council, but I also lead on research and intelligence for the CHAMPS Public Health Collaborative. Please share today's session on LinkedIn. So that's our preferred platform for building some momentum. Please use that to tell other people that you're in here. And for people, quite often we'll get this question. They say, are you going to share the slides? Absolutely. Not only are we going to share the slides after the session, but I need to also let you know that we will be recording this session and we'll be able to share that recording so that you can potentially share it with colleagues who aren't here. As ever, CHAMPS run a number of sessions, and so there's a little bit of a plug here for CHAMPS and the sessions that they do. This webinar is certainly an opportunity for us to come together and learn about something new, but also connect with colleagues across our system. There's also a range of other CPD events that CHAMPS also runs. So please, if you don't already receive Collaborate, our regular update, please do sign up for that newsletter. Is there a link possibly in the chat so that colleagues can see how to sign up for Collaborate? So I think I've covered basically all the housekeeping for now. So let's get on to the actual reason why we're all here today. So we've got a webinar that's been organised, and the aim of that is really to bring together our public health community who are interested in research in particular, to introduce them to some of the opportunities that we have around research in public health. We're going to hear from a range of really interesting speakers, and honestly, if I wasn't standing here in front of you now, I'd certainly be signing up for this, because there's some stuff on here that I've really wanted to learn a lot about. So we're going to hear from some local authority colleagues who are going to talk about how they've embedded research within public health programs. They're going to give us some practical examples of how they've done that. We're also going to be joined by colleagues from NIHR who are going to talk us through some of the support that's available within the system. They're going to outline some opportunities, practical tips, and most importantly and interestingly, some funding opportunities for us, as well as some practical tips. We're also going to hear from ARC Northwest colleagues about developing research and opportunities, again, within our system. Through hopefully this shared learning, some case studies and insight, we'll be able to highlight how locally driven research can actually enhance our practice, improve outcomes, and strengthen public health and our workforce. So you've heard pretty much all you're going to hear from me this first part of the session. So it is now incumbent upon me to invite our first speakers. So I'm just going to give you a little bit of an introduction to them. And we've also got some biographies that we're going to put into the sidebar. That just gives you a bit more opportunity to find out who they are and read up about them, and again, possibly follow up. So we're going to hear from colleagues from NIHR in the first instance. We've got Nicola, Sheen and Dr. Helen Munro Wild. Helen and Nicola are going to outline how the centre supports developing research proposals, securing funding, and expanding research use in local authority or non-NHS settings, including opportunities like grassroots funding for those who've got little or no research experience. So without further ado, I'm going to hand over to the two of them. Thank you. Welcome.
Good afternoon, everybody. It's lovely to be here. I'm going to start off the presentation. Helen will take over in a moment or two. Great to see some familiar faces and names coming up on the chat as well, and really interesting to see the different backgrounds that you guys are all from. And that really speaks to what we're trying to do as a service. So I'll move on. If we can have the next slide, please, just to give you a little bit of background about the Specialist Centre for Public Health. So we're a national centre. We're delivered by Newcastle University and partners, and we have 3 satellites across the country as well. And essentially, we're here to provide support for public health research that sits outside NHS settings. So that can be local authority, that can be BCSE, that can be education, that can be prisons. There's a number of different settings that we're working with. And we're here to help support the creation of high quality research evidence, and helping people get an understanding of how evidence can help them with a view to informing their policy and practice to tackle health inequalities and improve public health. And the way we've gone about that is by developing resources and our areas of support and funding calls and that kind of thing, all very much with our audience in mind. So if you were to get in touch with us and to ask us how we could support you, there's a little bit of detail here. The research design advice I'll only touch on because Helen's going to go into more detail about that. But we're a little bit different in that we will have really early conversations with you to help you shape what a research project might look like or to help you look for funding opportunities. So don't ever think that it's too early to get in touch and ask for help. We've developed the training and development offer, which I'm leading on that pillar, and that is all about creating the capability and capacity. So essentially, how do people learn how to do research, or if they're further on in their practice, what opportunities are available to them to develop their capacity and capability. And so trying to speak to the spectrum of people that we know are interested in the public health research field. On research governance and ethics, we know that it isn't necessarily established practice out there. People are finding their way around what works, what's pragmatic for their local authority or their organisation. And so we're doing lots of learning around what are people trying, what are they testing, where are the examples, where's the shared learning. And we're developing some guidance and some templates around that, but very much with the mindset of not one size fits all. It's got to work and apply in your setting. So that's why we're kind of keeping things very much in an editable format so they can be given that shaping and sense of place. We are running a research delivery pilot, so that is a funding stream for 2 years, and that is essentially us scoping and making a suggestion of what a delivery service for public health research outside of NHS settings might look like. So we're about 6 months into that now, and that was an exciting addition, shall I say, from when the Specialist Centre was first formed and created. And we've got our bespoke local authority support and resources. So I'll go into a bit more detail about that, but essentially they are, I know we've got some LARPs on the call, our local authority research practitioner roles, our FEL roles, which are public health engagement leads, and some specific funding that we've created as well. So if I can go on to the next slide, please. So you'll know that public health is peppered with acronyms and jargon. So for anybody who doesn't know, HDRCs, Health Determinants Research Collaborations, NIHR centrally funded 30 of those, and they're well into their practice now, and they were set up to develop capacity and capability in the local authority that received that funding. The LARP role, the local authority research practitioners, were part funded by us. So the Specialist Centre has put funding into 90 local authorities now. And essentially the LARP role is almost like a mini version of an HDRC. They're seeking opportunities to find out where research is being used, where could it be used, and again, upskilling the workforce, so that capacity and capability building, and looking at the local sense of what is needed and where could research help. The FEL roles are senior policy and public health practitioners, and they are given a geographical patch to look after. And that role is very much a connecting role. It's looking for areas of synergy or where research practice maybe could be shared. So not necessarily a doing role, more of a connecting kind of role. And the Champs FEL is Emma, and I've got Emma's details there on the slide. Again, we've said these will be shared, so you can reference more of this detail after the presentation time if you did want to get in touch with Emma. Next slide, please. So onto some of our training resources. And we can go straight to the next slide for this, please, Anthony. And I'll just whiz through a couple of the bits and pieces that we've created. So first of all, we have 3 very short animations that explain why research is important in a local authority, how it works, how it's applied, how it can help people in their practice and in their delivery role. And these have been downloaded thousands of times. They've been at food festivals, they've been in newsletters, they've been on the big screen in the council chambers. And please, when the resources are shared, use and share any links to any of these resources that you feel would be useful. We have a webinar series, and that can go through things like methods that can be helping you to write a grant application for funding. That might be public and community participation. It might be data analysis. There's a whole suite of resources on there that are all recorded, so you can go onto our YouTube clips and play those back at any time, or again, embed the links and things that you're sharing. Next slide, please. We have a series of learning stories that we've written, very much in lay language, and these are 1 or 2 page, easy read, engaging stories that an elected member could pick up or a member of the public could pick up. And it describes and gives examples of how research is being used and what systems and processes are being created in local authorities. So it really is that sharing of learning and the tried and tested methods, where the successes are, where people have had to pivot because something maybe hasn't worked out quite as they thought. But again, all of that sharing of knowledge and learning so that people can get an example and think, oh, okay, that sounds really doable. Maybe let's try that, and creating that positive atmosphere around getting involved in research. Public and community involvement engagement resources. So we've written some bespoke training guides and slide decks for this. Again, that's a newer area. A lot of people do a lot of consultation, or they involve public in some ways, but they may not have used them in specific research methods. We've developed a glossary of terms, again, to just demystify some of that jargon and just help people access the language of research. And there's a link to all of these resources on the slide here for when they're shared. Next slide, please. So as well as the NIHR funding calls, we have also developed our own streams of funding. I'm just going to detail one today because we've got a number of things that are live at different times, but this is actually active now. This funding call closes on the 9th of June, and essentially it is for first steps into formalised training for research. So the expectation is that an applicant may never have done any formal research or had any formal training before. So it's a pot of up to £5,000 that pays for training and also backfills salary. And that's with a view that it would possibly be something very part-time and quite short-term that just allows access to this training. So the opportunity is open to people in local authorities in England, or if you're working in a BCSE organisation who receives a grant or is commissioned to deliver services on behalf of the LA. There's full eligibility criteria and information if you follow the link that's on this slide. Now, given that the 9th of June isn't that far away, if we go to the next slide, please, you'll see that we intend to have this funding call again a couple more times. So there's one planned for this winter and again for next spring. But as you'll see on the last slide, when Helen runs through the remainder of the presentation, all of the ways of connecting with us are detailed there. So please join our mailing list, and that'll just keep you abreast of all of the other funding calls and opportunities that we have. So Helen, I'll pass on to you.
Thanks, Nicola, and hello, everyone. So I'm going to talk a bit more about the pre and the postdoctoral funding streams, and to talk a little bit about some tips around thinking about your applications. So methodologists within the Specialist Centre for Public Health provide research design advice for individuals interested in non-NHS public health research, and they can be at any stage in their career, people who are seeking support with developing research projects or applying for the fellowships. Next slide, please. So we support people applying to large funding bodies, but also provide general guidance and advice on any aspect of public health research outside the NHS. The design advice service that we offer is one of the 5 areas of support that Nicola's already touched on. So our approach to support is really grounded in ensuring strong community engagement and public partnerships. to ensure equality, diversity and inclusion is properly considered in all applications, and that the focus is on tackling wider determinants of health and reducing inequalities. So we can offer support around the fundamentals, like designing the research question and looking at which funding stream is the right one for you to apply to, right through to advice on health economics and methodology. Quite often public health bids take a mixed methods approach, and it may be that you are more familiar with qualitative or quantitative or members of your team, so it's important to help you, to give you the support with the methodology and to make sure you have the right people in your team. So we can help you to build a team and to connect you with other researchers working in similar areas. And we have Community and Public Advisory Group who can help review your plain English summaries. So if you get in touch with us at the early stages, which I think Nicola's already said, we can really help support development of the bid. And then towards the end of the process, we can review drafts ready for submission. Next slide, please. So the NIHR Academy is responsible for development and coordination of NIHR academic training, career and research capacity development. And it plays a really important role in attracting and training and supporting the best health and care researchers to tackle some of the really complex challenges that we're currently experiencing and ones of the future. So part of this is to identify health trends and priority areas and to really ensure that we have researchers working in those areas and they're sufficiently skilled and networked with the right people. So I'll go into more detail on the next page about some of the key offerings, but the Academy offers a range of fellowship opportunities from short placements to postdoctoral fellowships, specifically aimed at researchers working in local authorities. There are also pre-application support funds, and these are smaller funding streams that help people become competitive for bigger NIHR career development awards and fellowships. So the money for these smaller awards can be used if you need extra time, if you need some mentoring, training, or some support before applying for a fellowship. So to find out more about the different NIHR funding streams, you can go directly onto the NIHR Funding Opportunities webpage and have a look there. So if I could go on to the next slide. So I'm going to talk a little bit now about the Career Development Awards. So just to start with the pre-doctoral awards, so they provide support at a master's level. The funding opportunity opens once a year and is in January, with start dates on the first of the month between September and March each year. So the duration of those is 12 months with up to 20% of your time for your professional role as a practitioner. The pre-doctoral awards funds a programme of training and development, so that's really designed to advance your health and social care research career just at that master's level. The doctoral awards are to support completion of a PhD by research. The duration of these is 3 years, and we have 2 opportunities per year in April and June and October and January. And there's a current call out at the moment, and the deadline for that is the 23rd of June. So in terms of the doctoral award and what it funds, it includes your full salary, and it also includes the cost of the research that you'll be doing, along with any training that you may need, any mentoring or courses that you may want to go on. The postdoctoral award, there's 2 opportunities again for that per year, April and June and October and December. And again, we have one open at the moment with the closing date, the 16th of June. The award offers between 2 and 5 years of flexible funding to support you to take you to the next step in your career. So again, it supports your salary and gives you a tailored academic and professional development programme. It includes things like conference costs and dissemination of your research. So all award applications are reviewed by local authority social care and public health committees, and it's important that people working in public health, such as yourselves, consider an NIHR Development Award, as you're really in a very unique position to shape research that directly influences your communities, your services, policies that affect you, and to be able to build your skills really and your networks to support practice and lead to impact. So if I could have the next slide, please. So I think I've already mentioned the pre-application fund, so I'll just say a little bit about the local authority short placement awards. So this is really so that people can spend time working across universities or NIHR research settings and local authorities or council commission services. The aim is to really help researchers and practitioners co-create research that's really relevant and useful in terms of the real world policies and what you're doing on the ground around practice, especially in terms of public health, social care, and to really drill down to some of the health inequalities that you might have in your patch. The important thing just to say here really, and I think Nicola's already said it, is that as NIHR advisors, we can help with all of these things. I mean, all elements of the fellowships or applying for money, and you can use the inquiry form, which is shown at the bottom of the slide here. It's just very simple inquiry form, just to give us some details and to allow us to assign you a methodologist that's going to be most helpful to you. And it's usually up to 3 methodologists that can help, and we can bring in other people with specialist skills or interests if that's what you need. Okay, next slide. So I'm just going to give now some sort of advice really and some tips. I mean, I think this can be difficult sometimes at not knowing sort of where you are with your research currently, but just in terms of applying for fellowships, I think this can be a really useful route for research development. It gives you the time. It also provides the opportunity to develop your skills. So really the fellowships are mainly about developing you as a researcher. So you usually propose your own research question and you'll design the programme of work. And often those people who are successful with the pre-doctoral awards will go on to get doctoral awards. I mean, that's often the way it works, that once you've applied and been successful for one of these, you're more likely to be successful in the future. And if you apply and you're successful, it's important to say that you become a member of the community, which means you have access to things like annual conferences, mentorship programs, panel discussions. So actually the support continues, I think, you know, when you get one of these fellowships. So just in terms of advice then, so consider the level of award you're applying to. So obviously that has to be appropriate for your level of experience. As I've said, if you apply for a pre-doctoral, then it ups your chances of being successful at the doctoral level. It's really important to read the guidelines, make sure that what you're proposing is in remit, and then you can really demonstrate what's being asked for that. So that means in terms of your own development as a researcher, but also in the topic area that you've selected. It's important that you really think about everything, that the application is a kind of holistic thing. So not just about the project, but about the organisation that you're going to be sat within, or the people that you'll be working with, how you're going to involve your local communities, how you're going to think about research inclusion, making sure that you include underrepresented groups, and you're really you're thinking about impact to the future. So the right team is really important. I think you want to ensure you've got good mentorship, but also that your team has the right mix of skills in terms of what your research question is and what you hope to gain from the fellowship. And we say this a lot, we're always saying come to us at the earliest possible time, but I think it's true. We can all want to develop something that we think is close to perfection before we share it with others, but I think it's really important to get people to look at what you're thinking and what you're building as early as possible. And as methodologists, we're happy to look at things at the early stage. Okay, next slide, please. Lovely, thanks. So aside from fellowships then, PHR advertise both commission, theme calls and researcher-led calls where the topic is chosen by the researcher, and those come out approximately 3 times a year. Commission calls are on a specific topic area where the NIHR PHR programme has identified a priority area and where there's a gap in evidence. So in this case, you'll need to respond to the specific research brief, and examples of recent and ongoing priority areas include that are relevant probably to local authorities include smoking, increasing uptake of vaccinations, and overcrowded homes. Again, having a really strong link to impact is key. So you need to be able to show that you know what's happening in your topic area, that you've looked at the existing literature and identified a gap, but that what you're proposing to do will have an impact in terms of how it's implemented on the ground. It's also important to be able to generalise findings to other geographical areas, and NIHR are particularly interested in interventions that can be scaled up. And where we can demonstrate the likelihood of a population-based benefit. Community engagement should be weaved in throughout and be tangible in every element of the research cycle, and again we can help with that. Research inclusion, so there's new policy around sex and gender, and you have to address sex and gender in your bid explicitly. So this new guidance has been introduced in recognition that underrepresented groups need to be included in research, and that sometimes we don't collect sex and gender data appropriately, and we actually can use the terms interchangeably. So we know that sex is a critical determinant of health in terms of how disease might present, how different risk factors of disease present. And so just like in NHS settings, actually in terms of your non-NHS settings, it's important, when we're thinking about things such as, school attendance in relation to menstruation, or differences in terms of accessing community support for men and women. So that's a key part of your application. It has to be explicitly mentioned in your application. So we've talked about the team, and again, just to say, successful PHR applications tend to be mixed methods, so they combine usually both quantitative and qualitative aspects, and it may be an area where you need to think about in your team who has those skills if it's not you, and it may not be. Thinking about bringing in academic, charity and community partners is really important. And then just, I think this is the last slide. So I think most of these points have really been covered, but I think it's important to say that the committees may not always have a lot of knowledge around your particular topics. It's always important to use plain English whenever you're writing your application, but particularly for that plain English summary. We have a group that can review your plain English summaries and make sure that the language is not overly technical or complex. And actually the prioritisation committee in round one, the outline stage, really rely quite heavily on understanding what your intention is just by looking at that plain English summary. In terms of the research design, I don't want to get into too much detail here, but I think this is where the methodologists can really help support, just ensuring that your sample size supports what it is you want to do with your research question, and how you can do your subgroup analysis, whether you have the sufficient sample size if you're doing quantitative. In terms of literature reviews, again, justifying whether it's scoping or systematic, depending on the purpose of your research. Just good writing skills, so always ensure you've got good internal consistency when you're writing a bid, and also it's important that your aims and objectives really link to each of your work packages within your description of what you're going to do, and that you can link those aims and objectives clearly to the outcomes that you will be measuring. Something that's close to my heart is recruitment. I've worked quite closely recently on a project working in schools on recruitment, and without recruitment, without your sample, you have no research. So I think it's really important in your bid that you present a really convincing argument for how you will access your sample, whether you will include people who are underrepresented, and that you can recruit the number of participants that you need, and you can retain them. So I think that's really important. Allow plenty of time for feedback. We sort of talked about that. So start drafting early, get as much input for as many people as you can, and contact the support service in the early stages. So I think I kept to time. So just to say thank you from us, and we look forward to hearing from you, and I'm looking forward to hearing from the rest of the speakers. Thanks for inviting us.
Thank you very much, Helen, and also Nicola. I've attended a lot of presentations where sort of some of the work that you do has been discussed, but I don't think I've ever heard it explained so clearly. I do know that there are lots of opportunities, and certainly you've mentioned two that are literally closing quite soon. So I hope that colleagues on the call can really look into this. We will have a combined Q&A session after we've heard from all the speakers, so I will encourage you to keep putting your questions. Now, where they're quite specific, we will probably be able to answer them immediately. So please do feel free, just keep feeding your questions through. So once again, thanks to Nicola and Helen. So I now have the great pleasure of inviting Professor Ben Barr to speak to us. Again, his bio is going to go into the chat on the side. For many of us, Ben needs no introduction. He's a professor in applied public health at the University of Liverpool. He's going to focus his presentation on what the ARC is. A lot of you, like me, will have heard of the ARC and thought, what on earth is that? So he's going to tell us about the ARC, how they work, the data interaction process that they have with CHIL and NHS Cheshire and Merseyside. Please don't ask me to explain what CHIL is. I'm sure Ben will. They're going to talk about some real projects that have taken place across healthy environments, wider determinants and equity. He's also going to talk about first, both national and something called LILAC locally. We love our acronyms, don't we? And he's also going to talk about the EOI route into internships, fellowships, PhDs, etc., as well as the impact offer. It's a lot. So Ben, without further ado,
I'll probably talk about some of that.
Over to you.
Yeah, good afternoon, everyone, and yeah, great to see you all here. First off, I'd highly recommend the NIHR career development pathways that have just been talked about. That's how I started my academic career, doing a NIHR doctoral fellowship, and now I sit on the advanced postdoctoral fellowship selection committee, and we don't get enough people coming through local government, so definitely I would recommend that. So I'm going to just talk to you about not necessarily quite all of those acronyms that Ifeoma mentioned, but definitely talking about the ARC, the Applied Research Collaboration in the Northwest Coast, about some of the projects that we've had kind of going through that and the plans we have for the future, a little segue into the Public Health Intervention Responsive Studies team, which we also lead, one of the first teams, and some of the capacity building opportunities that the ARC can offer that complement the ones that we've already been mentioned. Next slide, please. So the applied research collaborations, what are they? So these are part of the NIHR funding that goes out to regions to support applied research and implementation. There's basically one of these collaborations covering each of the areas of the country. We are the Northwest Coast ARC, so which is basically all of the Northwest apart from Greater Manchester. They have their own ARC. We get funding for 5 years. We've just finished one 5-year period. A quinquennium apparently is the word for a 5-year period, and we're just starting the next quinquennium. The ARC has a number of themes, sort of focused with different areas of research. So I'm the co-director of the overall ARC, and I also lead the population health and prevention theme, which is the one I'm going to focus on today, although there are several other themes. Next slide, please. So we've got 82 member organisations across. Oh, I did give you a shorter set of slides, but we seem to have the longer set here. A number of different themes. But we're focusing on the public health and prevention theme. And we've got 82 partners across the region, so that's all the local authorities, NHS organisations, and several universities. The public health and prevention theme is mainly focused on trying to develop implementation and evaluation and action on the determinants of health and health inequalities, and also building capacity for that. Next slide, please. I won't go into the engagement process, but we have a whole sort of program of engagement across the region, feeding into the kind of delivery plan for the ARC, including with all the public health networks and beyond. Next slide, please. So within the first 5 years of the ARC, a lot of the work in Cheshire and Merseyside has been supported by this programme we have with the Integrated Care System and the Integrated Care Board at Cheshire and Merseyside, called the Data Interaction Programme, which is basically a partnership where we develop research and analysis to support priorities that are coming through the Integrated Care Board and the Integrated Care System. And we have a team of data scientists and analysts who use linked data across Cheshire and Merseyside. So they have access to data across the 2.9 million people, I think it is, across Cheshire and Merseyside, and use that to develop research and analysis to generate insights that can then influence commissioning and other decisions to put that evidence into action across Cheshire and Merseyside. And we've got multiple projects going through that, currently 26 projects have been through that sort of pipeline, and that's a great resource potentially for developing research and activity across the region. Next slide, please. So there's just some examples in the previous sort of 5 years of the ARC of projects that have come through that route. We've got a number of projects evaluating kind of healthy environments through the Groundswell and Healthy Urban Places programme. Some of those working with Wirral, for example, around access to blue and green space and promoting that to influence public health. A number of projects on the sort of social and economic determinants of health. We've carried out this large evaluation of citizens' advice on prescription in Liverpool, and I noticed Debbie is in the audience. So I'm sure she'll be happy to share with you her experience of working with us on that evaluation, but basically showed how it was saving the NHS money, and that kind of contributed to the continued commissioning of that programme. A number of other projects which I won't go into that have come through from colleagues in kind of local government and public health, where they've come to us with an idea and we've helped support turning that into evaluation and delivery. Next slide, please. So in the next 5 years of the ARC, we will be continuing that work. We've got the focus on 3 kind of themes of activity, where we're looking at supporting evaluation and implementation. So again, around healthy places, around improvements in the environment and housing, and evaluating and implementing improvements in that area. Household health resources, so that's building on some of the work that we've done around kind of local welfare programs like Citizens' Advice on Prescription, looking at how we can develop a better approach to kind of poverty mitigation across the region. And that relates to some of the priorities from Cheshire and Merseyside around their kind of marmot strategy, and developing action on the kind of social determinants of health and poverty across the region, and equitable uptake of prevention. So that's about better identifying sort of screening gaps and underdiagnosis, and targeting more effective kind of behaviour change where those needs are not being met. Next slide, please. That's aligned with the different kind of regional priorities, both around in Cheshire and Merseyside, but also in Lancashire and South Cumbria. Next slide, please. So within the ARC, we have a number of objectives. The first is fairly broad: scoping and co-producing evaluations and implementation. Some of those are continuing and building on work from the previous 5 years of the ARC, and these are some of the projects that we have already identified. across the region, so work around employment support, local welfare programs, so working with a number of councils around their kind of local welfare provision, a project in relation to looking at the health and wellbeing benefits of adult learning programs, modelling housing and need for housing improvements and better targeting that support, this development of a tool for better identifying households with complex needs, looking at some of the leisure services and how we can maximise the benefits of that, of the offers through leisure services through local authorities, and linking some of that work in with children's social care to better target some of that support to prevent trajectories into children's social care. So those are some of the projects that we have around that initial kind of objective, but that is not an exhaustive list. We are still looking for other work that you might have out there, things that you think are kind of promising interventions where we can either support their evaluation or support the synthesis and use of evidence within those projects that fit under those kind of three broad priorities. So we want to hear from you about anything that you think would be good to include in our programme of evaluation and implementation, and to work with us on that. Next slide, please. So our second objective is around working with place-based partnerships, and the area in particular that has come out through our initial kind of work with local authorities is around supporting the Pride of Place programme. So a number of neighbourhoods across the country are receiving funding from the government to improve infrastructure and the quality of those neighbourhoods, and we're looking at working with those neighbourhoods to both learn from the large number of similar projects that have happened in the past, trying to do similar things, so learning from the evidence of the past and getting that and synthesizing that to influence current delivery, but also putting together a research proposal around evaluation of that. So if you're involved in any of the kind of Pride of Place programs or interested in being involved in that, please get in touch. We've already been collaborating with a number of local authorities across the Northwest on starting that process. Next slide, please. So I thought it was a point it would be useful to just explain about the first programme as well. So that's a whole portfolio of kind of evaluation work that we're doing with people across the Northwest. A lot of that the resource to actually deliver those evaluations comes through the first programme, because we are also a public health intervention responsive studies team. And this is another NIHR programme that basically supports evaluation of local authority and public health interventions. Local authorities put in expressions of interest into the first programme, and that then gets allocated to one of the teams if it's shortlisted, and we basically support the evaluation of those programs. Next slide, please. Next slide. Yeah, so there's 10 of those teams across the country. We're one of them, yeah, there's a whole program of sort of evaluations that they provide. Next slide, please. So yeah, that's the process for submitting expressions of interest through the first programme. There's 2 calls a year, I think, for local authorities to submit expressions of interest. So they basically get allocated to one of the teams, and we basically put together a team to support the evaluation for the things that come through. Next slide, please. So this is just so we have to do we've had 5 years of funding for the first, and we have to do 10 evaluations over that time. These are the 10 evaluations. So many of the things that have come through the ARC, where local authorities and other public health teams have come to us with a research idea, we've helped them put in an expression of interest to the first, and then we've carried out the evaluation as part of the first programme. So a number of those 10 evaluations in the Northwest have also been supported by the ARC. Next slide, please. This is one of the first evaluations, was evaluation of Liverpool's Citizen Support Scheme. So this is a programme, I think it's about £4 million a year, that basically provides kind of cash and in-kind grants to households in sort of financial risk for support with kind of household goods. We've evaluated that and looking at its mental health effects and how much it saves the NHS money. And basically estimated for every £1 in grants that goes out, it probably is saving the NHS around 45 pence for each £1 spent. So quite an effective programme potentially for influencing people's mental health with kind of co-benefits to the NHS and reducing demand on the NHS. Next slide, please. So back to the ARC. Other objectives for the theme are around kind of building capacity. So that's working with networks such as the public health network in Cheshire and Merseyside in supporting people both in developing their research careers and research capacity through the kind of NIHR programs that we've heard already, and supporting those networks to put their ideas into and the challenges that they're facing into research and practice, and developing kind of research grants to support them. And then one of the final things we're planning on developing is a community of practice of people involved in evaluation. So there's lots of kind of involvement in kind of evaluation across local authorities across the Northwest. And we have the LARPs and the other and the FELs and the HDRCs. So we have potentially quite a sort of growing group of people involved in research and activity in relation to them. So the ARC is looking at supporting that community of practice and building in some support for learning from some of the evaluation work we've done, for example, through the first, and the kind of tools as part of that to help build capacity for evaluation across local government. And if you're interested in being involved in that, then please get in contact. Next slide, please. So the ARC also funds a set of capacity building programs, in addition to the ones we've already heard about through the other routes of the NIHR. So we have a whole set of internships. So these are similar to the grassroots program that was just mentioned. They basically will fund £6,000 for each individual to buy out some of their time from their employer to get involved in a research project and provide them with sort of supervision for that research from the universities in the ARC. So that could be something that was planned already within your workplace, doing some evaluation or some sort of qualitative research or reviewing evidence, and you could apply for an internship through the ARC. You would then get support from the kind of academic institutions in the ARC, as well as training and peer support to deliver that, and you would get some funding to help buy out some of your time. And we're going to be advertising them multiple times throughout the year. Next slide, please. We'll also be funding fellowships. So these will be 1 year periods where there'll be up to 14,000 sort of salary backfill to buy out time for people to carry out some research or develop some ideas to then apply for some of the other fellowship and research opportunities that come through the NIHR. Next slide, please. We also have a large number of PhD studentships that are funded. So if you know of anyone who's interested in doing a PhD, obviously there's the NIHR doctoral program that we've already kind of heard of, which is quite competitive, but we also have a number of studentships which are funded as studentships that people can apply for, and we'll be advertising those shortly and throughout the 5 years of the ARC. Those will be, so we'll advertise the ideas aligned to the priorities that we've mentioned for the theme, and ask people to put themselves forward for those PhDs. There's also the NIHR Insight program, which will fund masters. So it'll fund you to do a master's program if for qualified health and social care professionals. So you need to be on a professional register, including that can include the public health register, and then there's funding available for masters. Next slide, please. So that's basically all the different programs that we have. So if you have kind of research questions or challenges that you think research could help with, and opportunities to evaluate, or programs that you think would benefit from evidence being put into practice, get in contact with us, and we'll help you work through those those questions there. And if you think there's particular kind of capacity, then opportunities to take up those kind of capacity building, then please get in touch. So that's everything from me.
Thanks very much, Ben. Really interesting, and it's generated so many questions in my head, but I'm being polite because I know we have a Q&A session later on where we can bombard you with a number of questions that have come through. So yeah, thank you very much for your presentation. And I now have the pleasure of introducing Katriona Lloyd and Jamie Halliwell. Once again, their bios are in the chat. Katrina's a qualitative insight program manager, and Jamie is a local authority research practitioner, both from Wirral Council, both working in the public health team. They're going to give us an overview of some of the work of the qualitative insight team, how the team is helping to really embed qualitative research in the council, within the public health team, to really shape effective interventions and inform some of the strategic decision making. Katrina's also going to highlight some of the research tools that the team's developed to support partners to embed resident voice in local decision making. And Jamie's going to give us an overview of his role as a LARP and a little bit about the LARP network and how he is improving Wirral's ability to engage with research and evidence effectively. So welcome to you both, and once again, over to you. Thank you.
Thank you, Ifeoma. So hi everyone, I'm Katriona, and I'm here today to just talk a little bit about our team, the Qualitative Insight team, and how we're supporting to embed qualitative insight in decision making across Wirral. So just to start, Ant, if you're okay to go to my third slide. Just thought it'd be useful to tell you a little what qualitative insight is. So it's that information gathered from people that describes their experiences, opinions, and motivations. It can be used to help understand people's behaviours and influence decision making to better suit the needs of people and community. And it's helpful for a number of reasons, but some I'd like to highlight is around that capturing lived experience. So qualitative methods allow us to understand the real life experiences, stories, and perspectives of community members, providing depth beyond numbers.
It explores enablers and barriers also, uncovering the reasons behind attitudes and actions, helping explain why people think or behave in certain ways within the community. It can identify nuances and context, revealing cultural, social, and environmental factors that shape community dynamics, which quantitative data can sometimes miss, and supports co-design and engagement by involving participants in open discussions, interviews, or focus groups. So fostering trust and collaboration, making research more inclusive. And it does generate rich, actionable insight, which details narratives, themes, and helps design tailored interventions, policy, or programs that truly reflect community need. So just a bit about the team. The team were established back in summer 22. I'm the program manager. We have 5 qualitative researchers and an analyst. Our story really begins with our objective to provide that system and infrastructure for generating qualitative insights and analysis to inform policy, improve public service, and deliver positive results for people and communities in Wirral. We meet our objectives by building processes that enable us to get into our communities and start gathering their thoughts, experiences, and aspirations for themselves and for the place they live in too. We do this effectively as we're inclusive. We use caring and innovative ways to bring people together, reaching those people who do not normally want to speak to the council as well. In summary, it's about building positive relationships, and it works because we listen and we're impartial when speaking to our participants. So some of the work, on to the next slide, and these are some examples of our work to date. So starting from the left, we did some work when we initially started around cost of living. We spoke to residents and business owners about the effects that they were feeling because of the cost of living. We produced case studies and short videos highlighting the findings, and this was a really effective way to bring it to decision makers, and that went on to feed into the council's decision to fund some small grants programs back in 22-23. Moving on to the sexual reproductive health. Here we use small focus groups in schools with children, and also depth interviews with our LGBTQ plus communities. We went to familiar settings. It helped the team build trust with our communities. And then they also regularly attended these places, both before and after gathering insights to build trust. And the findings that we gathered went on to inform the recommission of the sexual health services here in Wirral. The third example is where we used ethnography to gather insights on fuel poverty. So this work has gone on to shape the council's response to fuel poverty, where they've commissioned services with Energy Projects Plus to deliver targeted services to residents in need. And this work, the team have also won Best Use of Local Area Research at LARIA back in November 24. And it was really good to get that local voice into that design and delivery. And then the last example, you can see some postcards that were included in this year's Public Health Annual Report, A Place to Call Home. So residents were asked to share their hopes for what their community should look like by 2040. People talked about safer streets, greener spaces, affording to buy their own home or better transport. So this was a clear reminder that the way we design, build, and look after our communities has a huge impact on our health. And by listening to local people and using their ideas to guide regeneration, how Wirral can grow into a healthier, fairer, more connected place to live. So the next slide is just to highlight some of those resources. In 24, the team realised that we needed some tools to support our community. So we developed the Qualitative Insight Toolkit to encourage and support insight gathering and sharing in Wirral. Its aim is to develop the skills of internal and external partners so they can evidence their work and help us better understand residents' health and wellbeing needs. And this year we have also done a toolkit called Talking and Listening to Your Community, and that provides really simple guidance for people who want to gather insights with people with learning disabilities. On the next slide, you will see that the toolkit provides some really clear guidance from the art of asking questions through to ethics when gathering insights. And we also share some templates as well that partners can just pick up and use as part of their own insight gathering. And then on the next slide, you can see the training program that we put in place. So following the launch of the toolkit, last year, our team produced a program of toolkit training sessions that were hosted in person and online to support our colleagues and community organisations and wider partners to enhance their own insight work. And that was a really good way of bringing it to life for people as well. In terms of impact on the next slide, impact of the toolkit, since it's launched, our partners have told us they've been able to use toolkit guidance and templates to develop organisational insight gathering practices, which has been really good to hear. They're build gathering practices into their everyday work, making insight gathering more efficient. They learn about and test out different engagement methods. They're thinking about data processing, organisation and analysis up front rather than I've got all this data, what am I going to do with it? They reflect on what works best for their organisation. They're able to train staff to support professional development and retention as well. And all this enables partners to embed practices that help enhance participation, such as the use of accessible research methods and community incentives. And partners are also able to use the insight they capture to enhance reporting and funding applications as well. So on the next couple of slides, if you want to move over to, and we thought to close the loop, it would be really good to give partners a place to share their insights. So last year, we developed a repository and it's now available on the Wirral Health and Wellbeing Knowledge Hub. So the Qualitative Insight repository is a central online platform for partners and council teams to share and view health and wellbeing insights gathered from Wirral residents. It hosts evidence sources which delve deep into the reasons behind the health inequalities that are experienced in Wirral, supporting providers to deliver a more targeted service response. So it provides the opportunity for us to work collaboratively with system partners, share community insights that can inform decision-making practices that suit the need of our residents and communities as well. And then on the next slide, it just highlights some of the benefits from supporting third sector organisations and by providing them with insights collected from residents, adding value to our own work here in public health and the wider council, having that accessible central location that hosts the qualitative insights that's easy to navigate and find, highlighting the breadth of work that's going on in Wirral and supporting that evidence-based decision-making and avoiding any consultation fatigue. On the next slide, it just highlights some of the findings from our partners, that they flagged that it's easy to search and find the quality assured insights which the team have peer reviewed. It also gives that opportunity to share their own insights on social media because of the way it's set up, go back to informing decision making, but also it makes us check and balance what we're doing next as well, so inform that future insight gathering. And just on my last slide before I hand over to Jamie, just to flag that currently, the team are about to undertake some more ethnography work where we're looking at points of crisis in people's life and what support would benefit them from. We're also doing work with CVF and continuing to gather other insights to support the implementation of our health and wellbeing strategy. We're doing a bit of a refresh, bringing some of the learning from the online sessions that we did last year into a refresh of the toolkit. We will continue to promote our repository, encouraging people to sign up. And Jamie and I are working with NIHR on some resident researcher work where we hope to train up some local residents on how to gather insights. And we're doing that with 2 community organisations. So I will pass over to Jamie now.
Great. Thanks, Kat. Yes, so I just thought in this sort of quick 5 minutes, just to kind of give a bit of an overview of my LARP role in the LARP network. I know Nicola did speak a bit about it earlier, but also sort of some of the work that I'm doing from like a rural perspective in my LARP role. So next slide, please. So yeah, so my LARP role is jointly funded through the NIHR and Public Health. I started back in April 2025. So before that, I actually was a qualitative insight researcher in the qualitative insight team. And so my role is like a 2-year placement embedding research into local governments. And in terms of what my role involves, so it's kind of to help council improve their ability to engage with research and evidence more effectively, facilitate and bring together research activity across the council. So to strengthen those internal and external relationships, and I'm open to suggestions for growing connections as well after this meeting as well. And also sort of upskilling staff in the application and practice of research. And LARPs don't tend to run research projects by ourselves, but they do help councils do more research and use it to inform decision making. So in our public health team, we've got a qualitative insight team, which Kat spoke about, and we've also got a public health intelligence team as well, who sort of analyse population health and monitor trends and that kind of thing. So I kind of sit in between both of those teams. Next slide, please. And I thought just in this slide, it might be quite useful just to give you a bit of a consensus definition of research, because I know probably from even speaking to our community partners recently, but also with colleagues across the council, it's kind of obviously having that definition of research. People might be doing research already, but using different words for it type thing. So sort of the NIHR's consensus definition is that local authority research supports decision making about practice, policies and interventions at a local, regional or national level, or it does help us understand how people are impacted by the context in which they live, work and go about their daily lives, and also how research uses structured, organised and reproducible methods to produce new information or knowledge that may include testing an idea, theory or new intervention, and provide a new interpretation of existing information that might be used routinely collected or publicly available data for a new purpose. And next slide, please. So just to sort of flag that us LARPs in our different councils are sort of at different stages of research readiness. So these stages aren't necessarily neat, and sometimes research might also be happening beyond public health. So for example, in social work. So we're at the build stage. Yeah, that is correct. Yeah, so we're so research process and infrastructure being developed and exploring those external funding opportunities. So as I said, we've got sort of quite an established qualitative insight team, and we've got our public health intelligence team as well. So I think we're kind of looking at ways to try to bring that a bit more together, and also applying for some external funding opportunities, which I'll come on to in a later slide. And also worth noting that some of us LARPs are employed in different areas of the council as well. So I'm based in public health, but some may land more central corporate services, for example. So they can be sort of dotted across different directorates in their councils. Next slide, please. So I'll just focus here more on the Northwest region LARP network that is growing, and Nicola did sort of explain that there's like 90 funded LARPs across England, which is amazing. So I know some of the LARPs are on the call as well, so hello to you. And just to flag, I think I submitted this before our Halton LARP came into post. So Matt Roberts is the LARP for Halton, and also Salford and Bolton are recruiting at the moment as well. And we recently met back last month in April, where we had our regional meetup. where we met in Liverpool, and we basically, it's the really good events just to kind of like, you know, collaborate on different things, you know, share achievements or challenges of like sort of embedding research in the local authority. We also talked about how some of us have been awarded public community partnership funding, which I'll come on to shortly. And also at that session we were able to kind of like collaborate on a session proposal which we proposed to the International Festival of Public Health, that'll be on in Manchester in July, and happy to say our proposal's been accepted to attend that conference. So 8 of us LARPs in the Northwest will be speaking at that event, so talking about our experiences of being LARPs, reflecting our LARP role, how we're embedding research across the council, and that kind of thing. And as I say, Nicola did also mention about the fells as well. Also to note, we do meet at those regional group networks, but we've also got some other activity as well regionally. So Elspeth Harper's our LARP for Westmoreland and Furness. So she sort of developed a bit of an embedded research network, which she sort of organises on a monthly basis. We also do regular fortnightly drop-ins with LARPs through our LARP network, which is organised by.
Sorry to cut across you, but we are running a little bit short on time. So I wonder if you can get to the next slide. Sorry.
Yeah, thanks, Ifeoma. No problem at all. So next slide, please. And just very briefly, I'll touch on some of the work that I'm doing at the moment. So I'm just doing a council data evidence and research skills survey. So that's helping colleagues understand colleague confidence in using data and capturing evidence, and also sort of help developing a bit of a training program around those survey results. Kat did talk about the public community partnership funding earlier, so we've been awarded that for 18 months. So we're working with 2 community partners to co-design training around that, and also I also support with providing research guidance and expertise on a range of projects in public health. So, for example, around indoor air quality and our population-wide health and wellbeing survey across Wirral. There we go.
Thanks very much, and so sorry for cutting across you. It's all really interesting stuff. So thank you once again to Jamie and to Katriona. So our next and final presentation for the day is from Elspeth and Irum. Once again, we're going to put their bios into the side chat, and they're going to talk to us about HDRCs in Liverpool. So I promise I won't interrupt you. The time that you were promised you will have, Elspeth, over to you. Thank you.
Perfect. Thank you, Ifeoma. Yeah, thanks for inviting us to talk. You heard a bit, didn't you, from our NIHR colleagues about HDRCs. So I'm just going to briefly cover what the HDRC is. There's loads going on in our HDRC. So if people want to find out more, I can't do it justice in this time. So please just do get in touch, and our contact details are on the slide as well. But next slide, please, Anthony. Next slide again. Got about that. So yeah, what is an HDRC? So HDRC, Health Determinant Research Collaboration. As was mentioned, there's 30 in the country. We are very, very fortunate as Liverpool Council to be an HDRC. I take no credit for this. I wasn't actually here working in Liverpool when it was applied for and successfully won, but I walked in right at the beginning of it and have been the public health consultant lead in terms of delivering it. It's a bit different because the funding comes to us in the council to do this, where normally, obviously, NIHR funding doesn't necessarily come to local government, which is great. It's very much a collaboration. So our HDRC is a partnership with us as the lead in the council, but with the University of Liverpool. So Ben is part of our HDRC, for example, with Liverpool John Moores, with Liverpool CVS and Health Watch as well. It's very similar to the LARP. It's a corporate programme. This is not a public health piece of work. This is about how the whole city council uses and embeds research. And it's not about the research itself. It's that point about the capacity and the capability to use research more effectively. Interestingly, in our HDRC and our council, we don't tend to use the word research that much because we find maybe it's a bit off-putting, or people think that's what other people do. So we tend to talk about evidence and evidence into action. And the quote at the bottom is what they said on the welcome webinar about the HDRCs, that this is a big experiment. It's because they're giving us the money this time in terms of being local authority led. Next slide, please. So just to emphasise, it's a whole council programme but very much focused on the social, improving the social determinants of health and those building blocks of health. Liverpool, we're a marmot city as well, and we've got strong health in all policies work going on across the council. So we're very much using our HDRC to enable and drive that work at a faster pace. We've got our Health 2040 State of Liverpool report, which has really galvanised the system there in terms of improving health inequalities. So the HDRC is about the evidence into action aspect of that work that we're doing. Next slide, please. This is a bit of a busy slide, but I think it's just trying to show you that there are corporate priorities from our council plan there in terms of the topics for scoping, which are all things which are probably across many council plans in terms of thriving communities, inclusive education, connected and accessible, sustainable cities. But what we've got through the HDRC and what we've built is a bit of what we call a pick and mix support offer in terms of how the HDRC can support in terms of evidence and into the decision-making processes that we've got in the council. The point of that then is that we make more evidence-based decisions as a council, which then ultimately will lead to improved outcomes in terms of our residents and our people of Liverpool. Not all questions and issues will need each of those supports, so it's very much depending on the question, the focus in support is tailored to the needs of that thing. So for example, we've been doing work about air quality and particularly looking at idling of vehicles and how if we could reduce that would improve health outcomes. We've been looking at doing a lot of work around the inclusive economic growth strategy that we've got as a council, particularly around young people not in employment and training. And again, how can we join up data a bit better there and how can we do that? And then in terms of adult learning skills, in terms of that work and evidence for action and also cost benefit for service delivery and in terms of that health economic analysis, which really has led to a more improved service offer locally in terms of our adult learning service, which we know hopefully then might improve pathways into employment for people mightn't it. Next slide, please. So as I said, this is a cultural piece. So we've focused as well on advocacy roles. So we've developed a number of them across the council. So we've got evidence champions, we've got our cabinet members who are our elected member leads for the programme. And then we've got our community researchers. And this is my segue to hand over to Irum, because we appreciate not everyone on the call, and I think it was in the chat, has the opportunity that we've got as an HDRC and the additional funding in terms of the broader work that I was mentioning. But we thought it'd be interesting for you to hear about the work we've been doing about community insight and community researchers, because we do feel there's a lot of learning there that people could apply and take forward in their own areas if applicable. And it very much complements what Kat and Jamie talked about as well. So we thought it was nice to have a qual focus from the local authority on this second bit. So I'll hand over to Irum.
Thank you. Next slide, please. So involving community is not seen as a single approach in HDRC. It's seen as a whole approach, and this includes the traditional public involvement approach, but some newer approaches like Liverpool stories and community researchers. And together these approaches captures different types of knowledge, from structural input to lived experience. And next slide, please. We tested this community involvement approach with the communities last year in December by delivering a workshop where we introduced our program and we also introduced our community involvement approach. The visual minutes on the slide capture some key themes and discussions from the session. This was a very important starting point for us because we were not there just to share information, but we were there to listen as well. And we got very good feedback on our approach, but we had some suggestions from the communities which we took into consideration, and it shaped our approach. So this was not just like a one-way engagement activity. It was an early stage of co-production that directly influenced how we developed the model. Thank you. And next slide, please. So what is a community research role? It is central to our approach because community researchers bring something that is often missed by the traditional research, like lived experience and a deep understanding of their communities. And there's some three key main aims of this role. And one, to design, deliver, and share research that reduces health inequalities. Second, to build research active communities. And third, to inform local policy in practice. It is a very active role. They will be contributing to the design of different projects. They will be supporting engagement activities. They will be also gathering insight from the communities, and they will be representing communities in discussions and research. And there is no formal qualification that we need for this role. Next slide, please. So what is the impact of our approach? We start from communities and working through our community researchers, gathering lived experience through conversations and research. And this insight directly feeds into the council decision making, and this directly supports the council priorities by embedding lived experience into decision making to better understand local needs, and also it also improves inclusion and equity by reaching to underrepresented groups, and enables early interventions, and it also makes the services more effective and flexible and responsive. Next slide, please. Following the initial workshop before the recruitment, we delivered three community-based recruitment workshops in the north, centre and south of Liverpool to make the opportunity accessible across the city. And these workshops were attended by a wide range of people. A lot of them were really rich lived experience and strong connections to their communities. The aim of these workshops were not just to introduce the community researchers' role to the communities, but also to gather some feedback on our approach. And what we heard from the community was very clear. They wanted research to be participatory, to be flexible, and to be grounded in real life issues like health, housing, and inequalities. There were some main themes around flexibility, about clear expectations and fair recognition. And we use this feedback to improve our community involvement approach, particularly our community researchers' role, our recruitment process, and our training program. So again, this was all co-produced rather than designed in isolation. And I would say these workshops are very successful because they were very successful in the sense that they helped build trust with the communities. Many of the attendees from the workshops then went on and applied for the role, and they also promoted this role among their communities. Next slide, please. So one of our main priority was to build a cohort that genuinely represents the communities of Liverpool. And I'm glad to say that we've been able to achieve that. We've got now 17 community researchers with lots of different backgrounds, communities, and experiences. We've got people from different ethnic groups. We have community researchers who have lived experience of migration, some neurodiverse individuals, paid and unpaid carers, parents, people from low-income backgrounds, and from all across the Liverpool neighbourhoods. And we've got a wide range of ages and skills as well. And this diversity is very important for us because it really reflects that we are capturing a broader range of perspectives, particularly those groups which are often underrepresented in engagement and research. Next slide, please. So what are community researchers doing and what have they done so far? The slide outlines the training that they have received. We started by introducing them to health inequalities in the city. We covered some major research foundations. We included some practical elements like quantitative and qualitative research methods. And our last training session that we delivered yesterday focused on community engagement strategies. We use surveys to collect feedback about these sessions so we can improve these training sessions for our next cohort. Next slide, please. And as I said, the training has finished. So now we have planned a celebration event for them in June, where they will come together and they will reflect on their learnings, and it will also give us an opportunity to collect some rich feedback from them so we can improve our approach moving forward. We will be giving them certificates in this celebration, so they're all really looking forward to the event. Next slide, please. I'm going to slightly touch upon our Liverpool Stories initiative, because this is one of our key community involvement pillars. The aim is to build a rolling cohort of 50 community storytellers who will share their lived experience in their own way through different formats. It could be a short video, written story, or poetry or photography, and we will be providing training for that. At the moment, we are creating a public advisory group for them, so that we can have community voices from the very start. We can shape this model going forward. Next slide, please. So looking ahead, after the celebration event, our community researchers are ready to be deployed into live projects. We're going to start from, we've arranged a speed dating event between them and the community, the neighborhood managers, where the neighborhood managers will introduce themselves and their areas they're working for. It will give community researchers a chance to choose who they want to work with. We are also starting our community practice in July, who will bring all the community researchers together to share their insights and experiences. And next year, we are planning to recruit our cohort 2 of community researchers. The focus will be on young people, because we recognize the importance of youth voices in shaping future services. So we're going to be, as moving forward, we're going to be testing and refining our approach, but the overall key aim will remain the same. It is very clear that we want to embed community insight into council priorities and decision making, so services are more responsive, they're more flexible, and they're more effective. Thank you for listening. And we're here for taking questions. We've got the email address there as well, so anybody who wants to get in touch later on, they can use that email address. Thank you.
Thank you very much, Irum. It was great hearing from yourself and Elspeth on that. So now we start our Q&A session, and I think we've managed to buy a little bit of time back in order for us to do that. We've been collating some questions from the side chat, and one of the things that I just wanted to reinforce or remind people is that you will be receiving a full set of slides, and within those slides there'll be links which may, if you follow the links, actually start to provide some further detail and may actually answer some of your questions. So I'm going to invite our speakers now to unmute their mics, if everybody else can remain muted. And I will go to the first question. So what we've tried to do is try and collate some of those questions that have come in. So our first question is, how can we improve visibility, access and engagement with research opportunities, particularly for those that are outside our traditional academic pathways? And I'm going to invite you, Elspeth, in the first instance to answer that. Sorry for picking on you.
Well, I think that's the million-dollar question, isn't it? But I guess we've heard today, haven't we, about the complexity of the system, but also I think, as you said, Ifeoma, probably explained in a better way than we've ever had it explained before. But when you're sat in local government, as I am, even though we are an HDRC, it is still a very confusing network and web to navigate. I think the positive is NIHR's focus on public health research, and particularly now on local government research skills and capacity. And we've heard a lot, haven't we, about the opportunities that we can find out more about, and the roles, I think, as well, that people, people like Jamie and other LARPs. And now we've got Emma, who's our FEL for Cheshire and Merseyside, who I know Emma sits in our public health team in Liverpool. She's fantastic, so I know she'll be brilliant in that role. She's only got 0.1 though of a time to do that. But I think the more we can build relationships and have those named contacts that we can go to ask the questions, to find out more, that's the way then you build relationships. I think certainly we're finding that, as I said, we're really strong academic links already. There's good relationships. I think what is nice about that is that collaboration aspect to it, and I think that's what we can focus on strengthening. So I think it was one of our NIHR colleagues who mentioned this, that we've all got different perspectives on things, haven't we? And we all bring different strengths to this. So the best research is always going to be when everyone, including our communities, works together on each stage of the research bids, which includes which includes developing the question in the first place itself, doesn't it? Because sometimes, quite often, it can feel there are opportunities to get involved in research, but maybe it's already a bit further down the line and the question hasn't been developed. So I think maybe something for us to focus on is that collaboration at all stages of the research journey. And I could go on for hours about this, can you tell? But I think the easy explainers as well. The easy explainers of things that are quite complex, and the videos and things like that, they're perfect, aren't they? Because we're all busy. So it's that translation of things into practice that is really helpful. But there's so much out there that already does that. And I think, whenever we've reached out, people are very receptive to having chats. And, as Ben said, a lot of this stuff is under applied for. So it's almost the onus is on us, isn't it, to find out more and put ourselves out there too.
Absolutely. So I'm going to ask the same question, but add a little bit, because there's another question that relates, and I'm going to direct this to Jamie in the first instance, and perhaps Katriona can add to it. So considering what I've just asked Elspeth, there's sort of an overlay question, which is, how can we strengthen locally driven sustainable research and delivery models that really maximize the impact of the available resources that we have, whilst also making sure that we can learn and share that variation, or learn from the variation that we see?
Yeah, so I think because I've just finished my I'm just sort of wrapping up my findings of my survey at the moment in terms of understanding how the current baseline knowledge around what data evidence and research is like across the organisation. I think from when I hear other LARPs as well, I think a lot of them tend to say it's going where the energy is. I think that sort of resonated quite with me. So it's kind of like understanding, I guess it's having those conversations, and sometimes it is just, I think, as Elspeth said, it is having those conversations, I think, and trying to access those people that you need to access throughout the organization to kind of promote the idea of research or promote sort of evidence. Some of it might be around evidence sharing. So, sometimes something I'm finding is that a lot of people tend to work in different silos across the organization. So it's how can we better share information, share data, and sort of be a bit more efficient that way. So I think for me, what I've learned through this LARP role, I think it is actually just having those conversations, especially I think that always having conversations, always looking to sort of collaborate with anybody sort of to help kind of facilitate that a bit more.
And
Thanks.
To add to that, Ifeoma, I just think it's that extension of the conversation into the communities and working with our community organisations and our residents. So being really clear that what we've learned is that trust, and to go out and gather the insights, but to go back and explain what we've found has been really, really helpful to us. And it's also enabled the next conversation to happen, because when we go back to those community settings, people are familiar with us, but they'll also introduce us to other people that they know, and there's that trust of, oh yeah, I spoke to them, they heard, they told. So I think it's actually showing the power of being involved and getting your voice in there, and it's certainly helped with snowballing for recruitment, for other projects and everything.
That's really interesting. Thanks for that. So I'm obviously, for me, I've stood for this, but standing here, one of the things that really strikes me from all the presentations that we've heard is that whether it's in an academic institution or whether it's in local authority, is talking to the community is a really important part of all the research, and also the need to actually share And so the repository that you've got on the Wirral is really, really exciting for me to see. And I do think, I mean, unfortunately, we're running out of time, because one of the questions that I had for Ben really was, how do we make sure that all that really rich work that is happening in academia, working with local authority, is shared with all of us so that we can benefit from it. My understanding is that there's going to be a link popped into the chat, which is an evaluation form. Please, can you just spend a little bit of time filling out the evaluation form? The other thing that I just wanted to, if you like, consider is the fact that there's going to be further opportunities. So a lot of what CHAMPS do as a collaborative is respond to that feedback. So if you feel that there is another topic that we need to explore, either as a result of today's webinar or something else, please do let us know, and potentially that evaluation form is your opportunity to do that. Now, I have realized I'm getting ahead of myself, because forgive me, I usually wear glasses, but not today. So I do have time to ask that question to Ben. So Ben, how are you making sure that the rest of us in local authority can learn from some of these evaluations that you've described?
So, yeah, I mean, I think that's a big challenge. And, you know, it is it's the communicating the results from evaluations, but probably more importantly, it's actually getting embedded in the decision-making processes in those organizations, where that, you know, the results from the Irish data get used. So I suppose that's part of the thing around the Data into Action program, is actually having people within those organizations who are committed to using the evidence from the evaluations. That is kind of the most important part of the process. Just producing results is not kind of enough to bring about change. You've got to have the demand from the services and settings themselves to kind of be committed to using that evaluation. So, I mean, if you think about the work that we did with Debbie and Citizens Advice, you know, one is having organisations that it kind of comes back to trust, really, that you've got to be committed to, you know, act on the evidence regardless of what you find. I think so. You have to kind of have that kind of bravery to say, you know, because you're going to get involved in research and evaluation. It may well not tell you what you want to find, or might not tell you what you're expecting to find. So being committed to opening up that, you know, what you're doing to that kind of investigation, and then being committed to act upon what you find, is probably the hardest part. And that's how the influence has gone into the commissioning system about that as well, because often commissioners aren't necessarily interested in whether things work or not. They might be more interested in what savings can we make to our budget or not.
But so one of the reasons I asked the question, Ben, is because when you were reeling off a list of different things that you were currently doing with local authorities, I was thinking, well, I'm thinking about doing that. Oh, I've been doing that. Or, oh, I want to do that. But if you're already doing the evaluation, then I've got something that potentially either bolsters my argument with others that, oh, I want to do this because it works, and it works in Liverpool or somewhere else, and I want to do it the Halton way. Or actually, well, you know that thing you want me to do, it doesn't really work because they've tried and there's an evaluation. I'm not going to do it. So I think by having something that we can look at, an opportunity to maybe have a repository of these completed evaluations, it would be beneficial to us and support us when we're making arguments for or against funding.
There's a whole repository of all the first evaluations. I've put a link in the chat to it. So
great stuff.
Each one produces a kind of local authority brief for each of their evaluations.
Thank you so much. So you see, we've answered that question.
But I guess the point is, it's obviously not being used as much as it should be. Otherwise, you would already know about it.
Absolutely. So that's really great. So I think as we're coming to the end of our session, I really just want to thank all our speakers. You've taken us through a really interesting journey today. What I would like people to do before they leave is actually, if they can write, let's have a look. If you can just pop maybe your key takeaway from today's session into the chat, that'll be really helpful, because we can then collate that and see just how people are feeling at the end of today's session. So yeah, if you can put your one word or your one sentence reflection in the chat, that'll be really, really supportive. Once again, thanks to all our speakers who've taken the time out this afternoon to speak to us. I certainly am feeling inspired. Yes, lots of people are feeling inspired. And I've learned a new word today, which is maybe I haven't learned it. Quinquennium, which I think is, I'm certainly going to see if I can use that in the coming week several times in meetings. So thank you everybody that's attended, and I hope you have a lot of interesting information to think about, and you will certainly have access to the slides to potentially give you more opportunities to ask questions and find out more. So thank you everyone.